Good day, everyone. I just want to say thanks for coming, because we know when we throw out kind of discussion about individual and family peer support, we get a mixed bag of whether we get a big group or a little group, but we think it's super important. So my name is Robyn Priest, and it would be awesome if people would share their videos. I know it's being recorded, so you don't have to. But if you feel so inclined, that'd be great, because we love chatting with people and not necessarily black screens, but we can do either. And don't worry about if you've got a question, throw your hand up throughout the presentation. We're not going to stand on formalities to wait until the end. Because it's a small group, we want to make this kind of as interactive as possible. So as Erin was saying, I'm Robyn Priest. If you haven't gathered yet, I'm Australian, or originally Australian. And I have to give a little heads up. I tend to be a little un-PC. So I will try and not cuss. Occasionally I will. It'll just pop out. So if that's going to be offensive, flick me a message really quickly and I'll work even harder. I will not drop the F-bomb, promise. The other thing is I'm a little un-PC in terms of I've claimed some words back for myself. So I'm the one, I always talk about one of us got caught by the system and labeled. So I'm the one that got caught by the system and given a mental health diagnosis. I talk about making a career out of being crazy. So I've had the fortune of working across 10 different countries in peer support. I did spend 8 years working in the US. I lived in Alaska, I lived in Denver, I lived in Texas. I worked for one of the SEMSA funded consumer-run technical assistance centers. So my whole job for a long time was developing recovery-oriented services and peer support. So that's, a little about me. And 5 years ago, I was speaking at a conference in Canada and Charlotte went, "Hey, do you want to start a business?" And I went, "Sure." And she said, "Well, do you have to move to Canada?" And I went, "Oh, okay." So off I moved to Canada, and I currently live in Winnipeg, Canada, which is in the middle at the bottom. And it gets warm in winter. Some days it's like -40 Fahrenheit. At the moment, I'm actually in Australia. I came to visit my mum and we came on a little holiday and she got COVID. So she's still in the hospital. I'm holed up in a hotel room and they keep moving hotels, so my hotel room. So I apologize for the light, but that's me. I'll let Charlotte do a better intro about herself.
Hey, thanks, Robyn, and welcome to our session, everyone. I'm Charlotte Sitnick. I bring the family perspective to our business. And just a little bit about me. If you had met me 15 or so years ago and asked me anything about mental health or peer support, I would probably give you a blank stare. And my daughter, who I call my tester child, my oldest, started to struggle with her mental health. And peer support was introduced to her in her teenage years, and I'll be forever grateful to peer support because it truly was one of the things that really kept her on this planet. She found hope in people who had something similar to her. But what was missing would have been a family peer worker there to support me, because at the time I was really fractured and broken. I was trying to save her. I was trying to do whatever I could, but my own mental health was really struggling. And when I had the opportunity to meet Robyn many, many years ago, I asked, what about the family? What about family peer support? And that's really where our business came from, was not only creating training and supports for peer supports for individuals, but also creating training and supports for family peer workers as well. So I hope you enjoy today. Hey, Robyn.
Hey, so I just want to do a little heads up. It's such an intimate little group. I wonder whether people would be prepared to either introduce themselves quickly by taking themselves off mute and saying whether you're an individual or family peer supporter, or if you're a little shy, whether you might throw something in the chat box, just so as we start to have these conversations, we can make sure we gear it to where you're coming from. So I'm going to give you like 30 seconds-ish for anyone that wants to unmute and tell us, or if you can just throw it in the chat box, that would be great too. So I'm going to be quiet for a little bit. Ready?
Hello, my name is Vanessa Alvarado from Lancaster, California. I'm 51, mom of 3, and I'm really enjoying more about this program every day. I was studying as a patient in mental health department, and now I'm like looking forward to be able to give back to my community. And I'm like looking forward to learn more about all your experiences. And I'm an advanced peer specialist. Thank you for letting me share.
Vanessa. Hey, Janice, I saw you on mute.
Yes, can you hear me?
Yep.
Okay, my name is Janice. I've been dealing with mental health since, probably, well, when I recognized it, I guess when I had my first son, that was 1976. And then I had a drug addiction rather, issues. But I worked hard on it. I've been in the peer specialist trainings for quite a long time, from advanced peer specialist to bridge, all of them. And I even went to school to become a drug counselor. Now I'm fixing to go back to school for mental health social worker. It's been a hard journey, but it was all worth it. All worth it. It helped me to learn about who I am, what I've been through, kind of how I got there. And it may be there always, sometimes I even look at movies and it brings back certain things, but I am truly grateful. So thank you.
Janice. I see we've got a couple of family peer support connections. Supervisor, we've got someone from the UK. We're transversing the world. US, Canada, UK, I'm in Aussie. Anyone else just like to throw it up in there? In the
Yolanda.
Hi, Yolanda.
Hi, good afternoon. My name is Yolanda. I work for Share Collaborative Housing. My journey is pretty much in mental health. I was in a horrible accident where I was shot, and after that accident, I couldn't put one and one together. I did go through DMH, and I'm very grateful that I'm here working as a peer bridger now. I've been working peer bridger for homeless population for 1.5 years, and it's been a journey on itself. And so I'm very grateful to be here and ready to learn more about what we got to do to support others. Thank you.
Awesome. Thank you. Hey, Gary, did you unmute? Or was I seeing
Yeah.
things?
Can you hear me now?
Yeah.
Yeah.
Okay. My name's Gary. I'm in Anchorage, Alaska. I have a where'd you live in Alaska?
Anchorage.
Okay. We were in Fairbanks for 8 years, so I understand cold as well. I'm currently working in individual peer support, and my first introduction to peer support was facilitating a family and friends support, peer support for mental health, and through a church in Fairbanks. So that's my story.
Awesome. And have you been part of the Echo series, Gary?
I'm sorry?
Have you been part of the Echo series run by the university up there?
No, I haven't.
Reach out to me at the end if you want to know.
Okay.
Okay. anyone else want to throw a little bit in before I get going with our presentation?
Yes, my name is Jerry. I have a history of drug and alcohol, mental health, a lot of trauma, prison, homelessness, all of that. And I'm currently in 25 years into my recovery. So I've been a drug and alcohol counselor. I've worked in dual diagnosed settings. Now I work at Tri-City Mental Health Authority in Pomona, California, and I'm supervising 9 peer support specialists, and we're spread out. So we do have some peers that are actually family support peers.
Awesome.
So yeah, adult outpatient for the TAs and family support. So I'm here to learn. I'm here to learn, to be able to share the information. Thank you.
Awesome, really appreciate it. You know what I love most about our conversation here is that it's super cool for all of us to go, yeah, I've done this, I've had this addiction, I've had this mental health stuff, I've been in jail, I've been homeless, I've been whatever. And the rest of us are like, cool. Like there's no judgment in any of that. We're like, those experiences shape who we are and what we do. So I am now, yes, of course, my screen is, there you go. This is what we want to focus on today in our session, is we want to talk about like why we have such a strong emphasis on implementing both individual and family-based peer support. Want to talk about the differences and similarities, because there are differences, and then just go through a little bit in terms of, well, how do we set these up and how do we set them up successfully? Because just like when we're putting peer support into services, if we don't put that structural piece in well, like we then end up with like what we call peer drift or scope drift, where people are doing something other than value-based peer support and not actually kind of getting that job done. So Charlotte and I have spent quite a bit of time over the 5 years that we've had our business together, like taking a look at like what are those similarities and what are those differences. And we put a little grid together, but I do want to say this isn't exhaustive. So we're going to throw some kind of conversations out here. But I also want you to start thinking about, when you think about the differences, what might it look like? But here I want to say really up front, it's not an us and them. You know how sometimes, well, you may or may not, but sometimes when I think about like individual and family-based stuff, sometimes we have different views when we're coming from our own individual perspective, and we've got kind of our views on something, and then our families coming from this perspective. And let's be clear, sometimes we're like butt heads. Why are you saying that? So, you know, for me, it's not about, I'm not in competition. And I just want to throw it to Charlotte to, you know, throw a bit of her thought around this too.
You know, when you were talking, Robyn, I was thinking of, you know, sometimes the family is thought of that boogeyman, or, you know, that they're not there to help. And often that's really not the case, because, you know, us as family members, we're just not sure what to do. And we're working on our own mental health as well. Robyn and I talk about the parallel process. When one person in the family is struggling, it impacts every member of the family. But not only that, each of us in our family, we have our own mental health story that we've added to the collective family. And for Robyn and I, family is whatever family is to the person in front of us. So in many cases, it's the traditional family, but sometimes it's a best friend, a coworker, you know, grandparent, parent, partner, parent to child, whatever combination it is. But the most important part is thinking about each of our own mental health, that collective mental health in the family, and the impact that it has on all of us. And Robyn and I recently were working with our first polyamorous family, and what that was like when, it was one of the members of that family was struggling, and it really to us is whatever family is in front of us. And I really wanted to start to talk about that too, because me as a family peer worker, I'm supporting the family member who's supporting somebody who's struggling with their mental health or addiction, whatever that looks like. And it's not about me supporting them to fix their individual person in the family. I'm there to support them and their mental health so that they can be in a space of better supporting their family member. Hey, Robyn?
So it's one of those things, Charlotte and I often spend time differentiating, because sometimes families come to, if it might be a family peer support group, and they're like, well, just tell me how to fix John. And Charlotte spends time, because I don't go to the family peer support groups because I'm not supporting families, but Charlotte spends that time talking with that family member about, I'm here to support you to like work through your stuff if you want, so that you can better support your son, daughter, brother, sister, friend, whatever it is. And that's often like a big shock to family members. I know that Charlotte has sometimes said, people go, that's the first time anyone's actually asked about me and how my health is. And so when we think about this, for me, it's, I want to use all the principles from individual peer support, and I'll talk about a few of them in a bit. But I want whoever's doing family peer support to use those principles when they're working with the family. So it is also thinking about, for me, when we think about this, we do want to think about what does family mean to you, because like Western traditional ways often go, I'm like, a family does this and it's all about, I'm going to support an individual because it's individualistic. And then we've also been working with Indigenous families, and it's not necessarily just I'm an individual and I'm going to do what I want. I worked in New Zealand for a while, and one of the people I was working with, so one of the individual peers said to me, I'm not tangata whaiora first, I'm whānau first and tangata whaiora second. Now, whānau is this collective family friend kind of way of talking, like community, and tangata whaiora loosely translates to person seeking wellness. So if I just took my Western way of working in and said, oh, as a peer worker, we're just only going to focus on you, like it doesn't work. So we also want to think about what communities are we working with and what do they look like, because that'll bring some nuances in the way that we're working. So when we think about this is where Charlotte and I did this little bit of a, grid, and we said, what's just about the individual? So if we look on the left, we've said that there's a specialty role as an individual peer support specialist, whether you're certified or whether you're an individual peer support worker. And then on the right of this, we've said there's a specialty role as a family peer support specialist. Now, one of the reasons why we bring this into play is there have been times in different countries I've worked in where people have said, oh, I can do both. I have an experience as a family member supporting someone. I have experience of my own mental health. I can do both of these roles. And Charlotte and I are really strong about saying, pick a lane. Like, I technically could do both. My father had his own diagnosis of bipolar. I've got a diagnosis of bipolar, dealing with my stuff. So technically, you know, I could do both. But what we've said, and what we always say to everyone we train and support, is pick a lane, pick the one that like jumps out to you. And Charlotte will share a little bit about herself here with this. She could probably, you know, play in either role at times, but it's picking that role that suits you. Hey, Charlotte, do you want to add something here and then maybe share that example of that like family and individual we worked with?
Yeah, I'm really passionate about picking a lane and really honing in on which ones speaks to you, like Robyn was talking about, because there's a little bit of nuances around how you support. And remember when I mentioned my daughter was introduced to peer support, and one of the peer support workers that worked with her, I was like coming to her and asking her for support and advice and like whatever. And she tried to do both. And what happened for me, and I'll be honest, like she tried her best. And so she would start to share stories of her own individual lived experience and what she was going through with her own mother. And for me, when she was describing these stories, just added so many more layers of shame and blame to me, because I'd already established this big old label that I, as a mother, had let my daughter down in the way I was parenting. And her mental health struggles was a direct result of my parenting, is what I believed. So when I finally met a family peer worker who started to talk to me from the perspective of a parent, it was just a little bit of a different way of being, because, you know, she would say, hey, listen, I totally get that. I too experienced that shame and blame. And that's where I just talk about that little bit of a difference, because the individual peer worker who was working with my daughter, she was sharing stories of perspective of what it was like for her with her relationship with her mother, not from the perspective of mother to mother. And that's where the difference for me plays a real important role. Like I said, she meant well, but it sure didn't land well.
I want to be super clear. When we put this together, we could have put stacks of things under individual and family peer support. We didn't. We took it as read that people who were turning up to the conference, you know, knew most of the kind of stuff around how do we do our roles as peer supporters. So we just put a few extra things in here. So what we've put in here is individuals may be part of a multidisciplinary team if they're, you know, in a team as a worker. And we always want to remember, even in those teams, we want to uphold the peer values. We always train that the family peer workers are not part of the multidisciplinary team, that they actually stand outside of that team and work with the families. Because there may be times where individuals are saying, I don't want peer support, and so the individuals don't have a peer supporter, but any of the families that are connected with people are offered that family peer support. And it's not something that the team need to know that the family are receiving. So we try and like hold it a little separately, and we're up for grabs. If anyone wants to respectfully challenge anything we say in this presentation, we're okay with that. One of the things for me is making sure that whether you're an individual peer worker or a family peer worker, that you're trained and mentored, that everyone's gone through training, that everyone like has a code of conduct, that we're supporting that role as a distinct profession. So we might not have the same education background as some of the other roles, like some of the clinical roles, but our expertise is that we live and breathe it and have lived and breathed it. And that's a skill in itself. And so for me, I say that peer worker specialist roles are professions and not for us to step away. And sometimes I hear peer workers or family peer workers go, oh, I'm just a peer worker. Like those roles are critical in supporting people. And so stand tall and stand proud with that. As we said, the family supporting the family member around their own wellness versus supporting them to work out how to fix their family member. So the thing that we're both doing is supporting the individual that we're working with to decide for themselves what they want. So I'm always saying we are not coming with an agenda. So, I know that sometimes when peer workers are put into teams, there's this thing about, oh, you should be getting the person to follow the treatment plan or do that. Personally, I train peer workers across the world to sit outside of that and support people to work it out for themselves. And they may or may not follow what the rest of the team want, but those peer roles are there to support individuals to explore for themselves and for family members to explore for themselves. I actually call our peer support worker training exploration facilitation. I say that peer workers facilitate exploration for whoever we're working with so that people can determine for themselves what they want. So again, it's coming with no agenda. I always talk about that we're advocating with, that we're not trying to advocate for people. I want to support people to advocate for themselves, whether they're family members or individuals, like depending on the role I'm in. I'm always working with individuals. Charlotte's always working with families that I don't want to advocate for. I want to support someone, be there with them while they do it for themselves, coming without that agenda of, oh, this is what we need you to do or need you to get done. And for me, it's intentional in every aspect. So part of my role in that exploration is to support people to explore for themselves. So I'm always in that conversation. And Charlotte's always in that conversation with family members too. So one of the things I want to say, we've put just recently, and I think, Jerry, you were talking about this, we've supported a large psychiatric hospital to put peer workers into forensic unit. So they've got both individual peer workers working within that forensic unit, and they've got family peer workers working with the families of those people who are connected to the forensic system. Charlotte, do you want to add anything about that? You've got a bit more connection with those peer workers.
Yeah, and for me, when we were working with that client of ours, it was really important that the family peer workers had that lived experience of what it was like to support a family member in forensics. So that was a number one for me, and finding peer workers who have that lived experience. And what was really great about it is those peer workers will work with families whose family members are part of the forensic part of that hospital, even if the individual doesn't want their family member associated with them or have anything to do with them. The family peer workers there can still work with the families And the reason why I say that's really important is I don't like when it's dictated by the individuals, because maybe the individual peer doesn't want their family involved now, but maybe they're going to want them involved later on. So if the family peer workers can work and support the family members on their own recovery journey, on their own mental health journey, they just become that much stronger of a support for the individual. And that part is really, really cool, like I said, for me. And then what happens with the family is they get tapped into different family peer support groups. They get tapped into different supports that are out there just for them. And they are introduced to a whole network of people that are very similar to themselves in their own recovery story. And for me, that also was an important part of my story, is I truly believed I was the only one on this planet that was going through something like that. And when I started to meet other families who were going through something similar, that became my support network. And it was a game changer in my mental health story when that happened. Hey, Robyn?
I want to be super clear. When Charlotte talked about family peer workers can work with people like families, even when the individual doesn't want their family involved, that's because there's no crossover of information. So there's none of that, like where families like knew their person was in the forensic unit, and the individual's like, I don't want my family involved. That was upheld, right? There wasn't any breach of that. But the family member was offered family peer support. So it was separate from anything to do with the individual. There was never any information being handed over to the family member about the individual. It was like a separate thing. So I just wanted to clarify that, because I know sometimes people are like, I don't want my family involved, and then there's this messiness. But it really was offering a distinct service to those family members. It's the same. We've also done work really recently at a crisis response center, a bit like a psych emerge, where people bring their like person in. So often families coming into that psych emerge with an individual who maybe does not want to be there. Individual peer support is offered to the individual who like oftentimes has said yes to it because they don't want to deal with anyone else. But that family member has also been offered family peer support, and they've been offered it, like it might be outside, they may go to the coffee shop, so that they're given that space too. And that's been working really well, because individuals have said, get my parent away from me, right? Give me some space. My parent thinks this is a crisis, and it's not. And I'm okay, and I just need this space. So that's part of where we've also supported the use of those individual and family peer workers. Hey, Charlotte, you've got a bit of a story about your own experience for that, right?
You know, as you were talking about, you know, get my mom away, and I was reminded of when I was really, really struggling, and I was living in reactive mode because I really wasn't taking care of myself, and I was so terrified of what my daughter was going through, that it was not going to have a good ending. So what was happening, anytime she started to struggle, I would take a hard night. So what would be a hard night? Well, she would say, Mom, I'm really struggling. Or, you know, she used to cut, or she would cut. And I would immediately think that this was a 911 crisis emergency. I'd either call an ambulance or the fire department, or I would take her to emerge. And what was happening was she was going through a hard night. She was really struggling. It wasn't an emergency. It wasn't a crisis. But because of my own way of being, because I was so terrified, because I was overreacting at the time. Off to the hospital we would go. And what happened when I started to work with a family peer worker on my own self, working on how to sit in my discomfort, work on my own self-care, learn how to manage my own anxiety, I was better prepared for those hard nights where I could sit with my child and support her as she was struggling instead of taking her to the hospital. Do you see what I'm saying there? Now, I am saying too, that if everything inside of me was saying this is an emergency, absolutely, I would have gone to the hospital. But so many of those nights, it was because of where I was at in my own mental health that I made a hard night into a crisis and an emergency. So when we work with families and we change how their mental health is, how their reactive is, whatever that looks like, we're able to support them to sit with their child, their partner, their family member in those hard conversations instead of rushing off to the hospital.
Thanks, Charlotte. Hey, I'm gonna move us forward. Now the video would be next, but I'm gonna push that back a bit later. So just bear with me, because I want to jump forward a bit to kind of thinking about, well, what do we do to implement this stuff? It's great to talk about it. And the video, hopefully we have time to show you, is from an individual and a family member from the same family who are sharing their experiences of this. But the rubber hits the road. We want to think about implementing. What do we have to do? So one of the things I want us to think about is that we really want to think about the peer values. Now, I've put the Canadian peer values up here, which are pretty goddamn close to the US ones. So, I could have put SAMHSA's up, but I was like, yeah, these are so similar. So we want that hope and recovery piece there. And we talk about that all the time in peer support. That word recovery, if we think about it around the world, there's a movement to come away from that word. There are people using wellness. There are people using well-being, because recovery is, for some people, they feel it quite laden. Now, when we think about the word recovery here, it means whatever it means to the individual or family that is getting support. So if we think about it in mental health, it may be I'm just dealing with whatever the symptoms are and I'm working out how to get through that. If we're thinking about the substance use world, it might be abstinence, might be harm reduction, might be medicated assisted. That it's that word that the person decides what recovery means for them. And so we want to remember that as peer workers, because sometimes we have it means something to ourselves. And we've got to remember it's not our perception. It's not our way of describing something. It's the individual's. Again, we're always in that empathetic and equal relationships. We also want to acknowledge the minute we're paid, it changes that dynamic. And we have to acknowledge that it's changed slightly there. Integrity, authenticity, and trust, same as always. We want to show up as real people. So who you get here is the person you get supporting you, is the person that you get down the road hanging out, and that trust piece is remembering those confidentiality pieces, that we don't breach confidentiality unless it's one of the big three: risk to self, others, or child abuse. Otherwise, what is talked about stays with us. Now, I want to share really briefly, Charlotte and I were asked to work with a family. I was asked to work with the individual. Charlotte was asked to work with the family. And we were very clear that we would not share with each other anything that was happening. I did not tell her anything I was doing with the son. Charlotte didn't share anything she was doing with the parents. And that way, if one or the other asked us, we were like, I don't know what's happening. They're doing their own thing. I'm just here to support you. And that made a big difference in that family dynamic. Self-determination, these are all the things that we know as peer workers we hold on to. Self-determination can be one of those interesting ones, right? Because sometimes we're like, oh, if that person does that, that's probably not going to be the brightest thing. It's not our job to convince someone not to do something. It's our job to support them to explore for themselves, whether that's a family member or not. But dignity, respect, and social inclusion, we know that. We know that's massive at the moment with everything that's occurring in the US. Even more so, us like being with people on their journey, being with families, being with individuals. So we want to make sure that when we're setting up these roles, that whoever's setting up has these core values, whether you're using the SAMHSA core values, whether you're using a mental health commission, they're similar, but you want to make sure that the services understand these from a peer perspective, not their assumption of what a peer perspective may be. I've also added some stuff here about Peer Support Canada have a code of conduct. You all have a code of conduct. If you're certified, code of ethics, code of conduct. I'm not going to run through these specifically because they speak for themselves, but you want to make sure that whether it's an individual peer role or a family peer support role, they have the same code of conduct. It does not matter that they're coming from different perspectives. What matters is that they uphold the code of conduct. So I've just put these here, and I know you have access to the presentation later to remind us that we have these code of conduct. And then we also have boundaries, which are a little more fuzzy because they may be our own boundaries that we have to think about, or the organization may have some boundaries as well. So when we're thinking about creating successful programs, we want to think about how do we create that management support. So that's that place about, I want to be clear. My mum's phone's going off and I think it's the hospital calling about her. So I'm just trying to ignore it at the moment. So I want to be clear, when we think about this here, management support is getting whoever is in management on board, that they understand peer support, that they're not trying to do peer support based on someone else's assumption, based on a clinical understanding of what it is or anything like that, that we want to have taken a look at policies and procedures. Are there things that might have to change? If we think about specifically in criminal justice programs, often when we're working with people from that kind of background, there's something in the policy that says people can't hang out with someone who has their own interesting backgrounds. Yet we're looking at peer support in forensics, in justice, where we actually want someone to have a colourful background, or a family member may have a colourful background as well. So we may have to look at some of those policies and procedures and see whether they can be kind of modified to suit the environment that we're working in. We want to have done training for other staff members about what these individual and these family peer worker roles are. What does that look like? What do they do and what don't they do? Do they share information? Don't they? What does that look like? So it's those kind of things we want to be cognizant of. And so I always encourage us to do a bit of a training session for all staff about what these peer roles, both individual and family roles, look like, so that they're going in with the expectation of what it is, not what they think it might be. So we also want to think about like those preparation pieces about, do we have clear job descriptions? Right, here's something I want to say just because I can. When I think about those job descriptions, I often see in some job descriptions for individual peer workers, someone has to be in recovery for a certain length of time. Now, what I want to say to that, and you know, I guess this might be challenging for some of you, is like that doesn't actually determine whether someone's going to be a great peer worker. And also, what does recovery mean? So if someone's in addiction, peer support, and they have a slip, does that mean they lose their job? In reality, that person having a slip can be an even greater peer supporter because they've gone through something maybe the people they're supporting are going through. Or if I have a mental health issue and I end up in the inpatient unit, does that mean I lose my job? Well, I hope not, because that's all that place about, as long as I'm capable of doing my job, it shouldn't matter like how long this recovery looks like. And yeah, I know that for some people that's like, hang on, we've got this stuff. I'm also seeing increasingly in peer roles that they want someone who's got like a bachelor's or a master's, and I'm fighting that and going, that's got nothing to do with a peer worker role. Whether individual or family, it doesn't matter. So I'm encouraging people to look at those job descriptions and look what the job is and what they actually need versus like what it looks like in their roles, not putting stuff in because we think we should have it, but putting stuff in that's relevant to their roles. We want to train people. We want to mentor them. Hey, Charlotte, can you talk about the community of practice kind of stuff that we've put together? Can you also share a little bit about the exploration mastery? Because I actually do need to check these messages that are going off about my mum.
I will. You know, and first of all, when Robyn was talking about recovery, I just wanted to talk just quickly about what that means on the family side, because often when you think of recovery, it's all focused on the individual, the one who has a mental health challenge. And as a family peer worker, my job is to support what recovery looks like for the family member. And it can often be very, very separate from the individual. So recovery for the family is their own recovery story. So if I'd met you 15 years ago and you asked me about recovery, it would have been when my daughter is back in school, taking her medication, all these things that I believed was what recovery was. It's all about her. But what recovery is for me is my own recovery, separate from my daughter's. And it's really important to differentiate that. Robyn was just talking about a community of practice, and we separate the individual peer workers community of practice and the family peer workers community of practice. And we focus on, there's some nuances around that, that Robyn talked about. So on the family side, what I'm doing is I'm supporting family peer workers in their role as family peer workers. And they talk a lot about things that come up with families as they're supporting their family members. And we talk about supports, how does that look? And it's really about the peer support values, how do we be a better peer support to family members and do our job. And I like to say that this is important because, well, for example, the last one that I did, it was all around talking about self-care supports for families and what does that look like. And they talked a lot about walking on eggshells, like the family members were really fractured and broken and really trying to support their individuals. And we talked about how can we support them to start to look at, can we, introduce how they can stop feeling like they're walking on eggshells, how they can start doing some self-care just for themselves, separate from their individual, just really teasing that apart and really focusing on supporting the caregiver or the family member. And from that, Robyn and I created what we call Exploration Mastery, and it's explorationmastery.com. And it's a membership for peer workers, both individual and family members. And we have peer workers from all across the world who are members of it. And we have community of practices, separate individual ones, and for family peer workers. It meets monthly. There's 2 times live sessions, and where you can talk about what's working well in your peer support practice and what do you need a little bit of better support. So you've got this audience of family peer workers or individuals who are there to share what's working for them and giving you some ideas of how to improve or hone in on your skills. And we have these live sessions every Wednesday, and Robyn's hosting one tonight at 7:00 Central Time. And it's the art of listening tonight. So it's really practicing and hearing how you listen and how you can support peers in your, as you practice your peer supporter roles. And if you can't come to a live session, we have a ton of videos on different skills are all around supporting you as a peer worker. So for tonight, you can't make the live session on listening. Robyn's going to do a recap of the key points that were taken away from those sessions, where you can watch them. It's about a 5-minute video, but really to the point, working on some of those skills. Here, you're back, Robyn.
Yeah, sorry. Hey, I saw a little bit in the chat. If you go to our website, which is here, like the robynpriest.com, on our website, it's got a button that says Exploration Mastery, and you can click on that and it will take you to that. Now, as we said, sorry, but there is a fee for that, because we're doing sessions, we're doing videos, we're doing community of practice. It's for an individual, it's $30 a month, or it's $300 for a year. We're working with different places for them to be able to use it as continuing education credits. If you're working for an org, we have a structure where organizations can purchase it for all their peer workers at a discounted rate. If you have an interest, email us and let's talk about it. But we've tried to add topics where peer workers, family peer workers are talking about things all the time. So we've talked about listening for the whispers, which is talking to people about if they're feeling like dying by suicide. We've got like strength-based support. We've got dealing with our internal stigma and discrimination and the impact that has when we're working with others. Like, we can send information if it interests you, but we have people from all over the world starting to join now. And so it means you can chat with people from different places in different service types too. Now, I want to acknowledge there isn't time to play the video. The video is embedded, so it will be up on the share website to watch that. I do want to ask if there's questions, because we can't really see you. So And like Charlotte just sent me a message and said, you know, if people want to reach out, can we give them a trial? If you email us and you've come to this session, we can give you a week trial for free for you to have a look at. Charlotte organizes that. So email her, tell us you came to this session, and you know, you can have a trial and see what you think. This isn't a pitch for buy this. This is we put it together because we felt like peer workers were being trained, and then it's like off you go. And everyone kept saying to us, we feel like we're just adrift out here and we don't get to spend as much time with other peer workers. But really passionate about having both individual and family peer support. I know that we've been fighting for individual peer support forever and we're still fighting that. But I'm okay to fight for both because Charlotte's really brought it home that if we don't have the families getting support for their shit, I told you I was going to swear, for their health, then they're no good when we're fighting for ours, because they might be enabling us or thinking everything's an emergency when it's not to us. And, you know, just doing things out of panic instead of actually being with us on the journey. So we've got a couple of minutes left, like 2. Do you have any questions? You've been very patient, very quiet.
Hello. Hi.
Hi.
It's not really a question. It was just a comments on some of the things you spoke about. And you had a saying up here in the corner when you first began. It was when you know better, you do better.
Yeah.
Yes, and I go wholeheartedly with that because I think as we grow, as we go through things, as we learn ourselves, we do, when we know better, we do better. And I'm one that likes to hear other people talk first. I like to have a rapport with them to try to understand who they are, what they're going through, what their issues are, because if I can't hear them or listen, I can't do anything. I can't even give them any suggestions or anything. So even with the drug and alcohol that I did, I've been 39 years clean of any drug, substance, cigarettes, smoking weed, smoking crack, any drugs. I don't do anything. And I'll tell people they cannot come to my house or come near me with any type of that. It's not that I'm being mean, it's that I don't do it. So I'm not going to put myself in harm's way to get there. Now, when I'm dealing with other people who are going through it, it's much easier because I know what I'm there for, you know, and I want to help them learn how to live a better quality of life. Somebody helped me during my issues of mental health, drug addiction. And to me, mental health are traumas that we don't get through sometimes. And some of them are really hard, mentally, psychologically, physically, you know, socially, it's a lot. But I want to be able always to listen to them first to get them to trust me. Because, and I tell my story too. I tell my story because if I don't tell my story, how do I know they know who I am as well? You know, and I have to do it in a way with sincerity. And as you talked about the ethics, not receiving anything from them, I'm not here to receive anything from you.
Yeah.
I'm here to just help you. Now, if you want to do something, give it to the office. That's to everybody. If you really have a need to do that, it's for everybody, not for me, because that becomes personal then, you know? So I love what I do because like I said, somebody helped me and I'm learning how to coach. I don't tell them what to do. You know, I may say certain things and I want them to speak back to me so I can hear what they're saying, what's inside of them, not me telling them what to do. So it's a lot in dealing with different people because everybody is not the same and you don't know actually what they're going through. So when I do these things of different things, I want to be equipped to do what I need to do in a professional way and in a loving way, in a kind way, because I want them to really get it. It's sometimes I've told some of the clients I work with, I want to see you one day. If I walk down the street and I see you, shoot, look,
That's cool.
you know, I mean, because it makes my heart joyful to see
Yeah.
somebody come out of it because it helped me. And I know it's a lot, you know, and it takes time, but it can be done. So when you know,
Absolutely. Hey, thank you for sharing, Janice. I don't mean to be a butthead and cut you
okay,
off,
that's all right.
but I'm
Go
also cognizant that we've gone over our time.
Thank
And
you.
I'm waiting for Erin to go like this to me.
Go ahead. Go ahead.
I was just kidding there. I was just gonna do like that was a beautiful presentation, guys. Thank you, Ms. Janice. I heard everything that you were saying loud and clear. Robyn and Charlotte, thank you guys for taking time out of your day to come and just let us know about the peer support and the family support as well. If you guys would like a certificate for this particular group or this presentation, please put your first and last name in the chat. And then what I'll do is we'll get it emailed to you. If it was something that you missed or something that you would like to look over, we will have this recording available to you guys, to the public, online at shareselfhelp.org. And okay, I see some of you guys in the chat for the emails. And other than that, I think that's it. At 3:15, we will have another presentation, and it's called Wellness in the Woods. And so that'll be at 3:15 in this same room, in the Harmony Room. But as of right now, Miss Charlotte put in there, thank you all for joining us, and please reach out info@robynpriest.com. And don't forget, they did offer that 1 week free trial. I might go do my 1 week free trial. And so other than that, thank you guys for participating. Thank you guys for coming and doing this for us. We really appreciate you guys.
Hey, take care, everyone.
Can you
Thank you.
Yeah, can you make me the host again, please, Robyn?
No.
You know what? And it was so funny because you only cussed like 2 times. I was waiting for you to cuss like a sailor. I was just like,
Truth be told, I often do, but I was being cognizant. I was being cognizant. So there you go.
Yeah, you did. I was expecting you to just, yeah.
I have. I'm always a little more cautious in the US. But hey, Erin, love it if you reached out and did a week's free trial and then let us know what you thought.
Okay, I will.
All right. Hey, take
All right,
care,
thank you,
everyone.
guys.
Thank you.
Take care.
All right.
Thank you.
Thank you.